Welcome to UroChannel. Who could have known that in the 21st century, masturbation is such an evergreen topic? Ever since my last video on masturbation, many of you left comments, and I thank you all for that. Actually, there were a lot of comments that revealed quite some insecurity with the topic, guilt, and misbelief. I don't know, I gradually start to become an old guy and naively thought that masturbation was not a topic of interest in modern times anymore. Sex all over the place and easy access to porn, depicting stuff that can be really challenging to the viewer. Take social media, for example, like Instagram. Lately, they have started to show me lots of women who present themselves in explicit outfits and poses. And that's for all the world to see. Just for the record, for the time being, the Instagram algorithm is showing me two things: almost naked women and squirrels. Haven't quite figured out why. But anyway, some of the comments I received felt like they were sent directly from a grave of someone who has been dead for 200 years. And that really made me mad. Who would do this to his child? Planting a whole bunch of demons into its young brain, thus crippling sexuality for life. Okay, religious people, time to leave this video because I don't want to hurt anybody's feelings. And there is no need to write insulting comments or hate sermons with 500 words. You don't have a chance that I will read them or release them into public. My name is Stefan Buntrock. I'm a board-certified urologist, and I am also a board-certified sexologist, meaning that I have an academic qualification that I acquired at one of the most respected university hospitals in the world. At the very same institution, sexual science was founded in 1919 by physician Magnus Hirschfeld, the Charité. This means that I refer to your state-of-the-art sexual medical knowledge that's totally unrelated to my own sexual preferences and experiences, because that's what professionals do. They don't bring their own personality to the table. So the first big lie about masturbation is that it changes penile size. Neither does it increase nor does it shorten the length of your penis. You might have been wondering why I chose Pinocchio for the thumbnail. Do you really believe someone's nose elongates every time they're lying? If the answer is yes, maybe you start to lie a little yourself. Who knows? Your penis might grow a few inches. Myth number 2 is very common. Masturbation causes impotence. That's absolute nonsense. It's rather the opposite. If you don't use it, you'll lose it. However, from professional experience, I know that some men don't know that the penis will not erect for a while after orgasm and ejaculation. It's called the refractory period. This is particularly a problem in premature ejaculators who are frustrated that it's over before it has even started and that they can't get it up a second time. That's not erectile dysfunction, but normal physiology of the body. Masturbation has nothing to do with your vision. That's a total myth. You don't go blind by doing it, nor do you need glasses sooner in your life. Masturbation does not drain any energy from your body. That's another lie. Except maybe in that ultra-rare condition that I have described in one of my videos, POIS, post-orgasmic illness syndrome. But that's not related to masturbation, but more precisely to ejaculation. This syndrome is so rare that you are considered an expert just by knowing the name. Now, let's answer some questions. Some of you asked about prone masturbation. This is when you lie face down on your stomach and masturbate. Either you rub your penis against the mattress of a bed or the floor, etc. With prone masturbation, it is not that clear-cut. Most men wouldn't suffer from any sexual problems when being intimate with a partner. However, unusual styles of masturbation that have been sustained for many years could cause, for example, intravaginal ejaculatory difficulties, because the partner is different from the mattress, or the pillow, or the floor. These unusual styles of masturbation your partner has difficulties to join in are also known by the name idiosyncratic masturbation. The so-called death grip is a technique where the penis is held very tightly in the closed fist during masturbation. If you are used to that style of masturbation, stimulation from your partner during intercourse may not be sufficient enough, and again, ejaculatory problems could arise. Therapeutically, one will have to work around this problem with the couple. But as I said, that's highly individual, and you can't predict problems from the behavior alone. Remember, many of those men don't have problems with a partner. Next question was about masturbation styles, which could cause Peyronie's disease. In principle, anything that's traumatic to the erect penis. Any unnatural bending beyond a certain point is not a good idea. That's a practice by the Persian name of Tagandan. Additionally, any insertion of objects into the urethra during masturbation is likely to cause a major trauma, leading to strictures and often consecutive penile deviation. Someone wanted to know what kind of strokes I recommend for masturbation. Well, generally, this is not a channel for sex tips, so I won't go into detail. Anything that doesn't hurt you will be fine. In conclusion, masturbation is not harmful, but promotes sexuality, and this is true for men and women. However, the penis is not indestructible. Unkaputtbar, we say in German. If you don't take care of it, it will indeed suffer from masturbation. But that's common sense, isn't it? You don't go ahead and remove bottle caps with your teeth either if you are in your right mind. By the way, don't miss out on the above-average membership on UroChannel. Become a member today and enter the 6-inch club. Thanks for watching. Bye-bye.